So my category was Antiemetic, and I chose the age range of 21 to 39. Erickson's stage of psychology or psychosocial development is young adults 18 through 40, which is the intimacy versus isolation stage. This is a 6th stage of Erickson's theory of psychosocial development. This stage revolves around forming intimate, loving relationships with other people. Success in this stage leads to fulfilling relationships in their life. Struggling at this stage, on the other hand, can cause like depression, feelings of loneliness and isolation, inability to open up and like self-disclose yourself, and past relationships can also lead to this and cause somebody not to be able to be successful in this stage. For my medication I chose was on dancesterone, also known as Zofran. It's to prevent nausea and vomiting for various different reasons, mainly for chemotherapy and radiotherapy, and also post-op sickness. It blocks, the mechanism of action is it blocks nausea and vomiting by the 5-HT3 receptor antagonism at 2 specific sites, central in area posterior and peripherally on the vagus nerve terminals. It blocks the vomiting reflex. Common side effects are constipation, diarrhea, agitation, dizziness, fast heartbeat, drowsiness, headache, and dry mouth. You can beat those by using like ice drops and whatever else. Ice drops, ice chips after surgery, of course. Any nursing considerations would be being aware of allergies and other medications that the patient's currently on. Just make sure that they're not already taking an antiemetic, and as well as just like any allergies that may be there, or any medications that can also react with this. And then you want to assess for extrapyramidal symptoms such as nausea and vomiting. Obviously, if they're taking this, they shouldn't be doing that. So if they are, then obviously it's not working. There's something going on. And you want to monitor their liver function tests. And administer when you give it. If you're giving it over IV, you want to administer it slowly because it can cause a fatal QT prolongation of VTAC. It can also cause respiratory arrest with rapid administration if you push it faster than over 2 to 5 minutes, depending on how much you're giving. 3 things the patient should monitor or be aware of is heart palpitations. You want to report this because, again, it can cause prolonged QT waves and VTAC and other heart issues that can be fatal. You want to report any shortness of breath, swelling of the neck, face, mouth, any anaphylactic symptoms or allergic symptoms. Stiffness and twitching of the muscle can also be a sign of a more serious effect beginning to take place. So you just want to make sure you're watching any symptoms that may pop up. And that's it.